No, I mean that's a whole political issue.
Right.
It's very clear that the TDD-MPS is currently the best product of its sort. It's an ingenious creation. Dr. Buttar's real genius is not in understanding the DMPS or any of those things, but is in understanding transdermal deliveries. You know, that's where his genius is at, and he's obviously using a technology that works.
Right.
And so, and yet, I do want to say that, you know, there's been that explosion in the last 20 years of the discovery that the transdermal delivery is for so many things.
Awesome.
The ideal awesome delivery, hormones,
right.
Pain medication.
Well, that's how it started. It came from the transditropin when they were trying to do the.
I know, but you know, before that it was the
right.
estrogen patches in women,
right.
or the androgen patches, and so forth. So that development, you know, has been there for a long time. It's now sort of exploding, and what we haven't even started to look at, you know, is what are other things that we could deliver transdermally.
Oh yeah.
You know, NDF, you know, works perfectly by just rubbing it in because it's already nanonized. It's already in a form that sips through the mucous membrane.
Well, he feels really strongly that all of his stuff will go right in, no problem.
Yeah. And so I think there's a whole other thing coming. And if you ask me, do I believe that the MPS is the best agent to deliver through the skin? Well, it was until a few years ago. Now there's other newer detox agents that are used in Germany and Russia that are far more potent than the MPS and will probably take the place of TDD-MPS sometime, you know, when maybe Buttar or somebody else use those agents, you know, and combine them with the technology. No, they're outside, let's put it this way, they're outside the FDA regulations so far and are not used yet officially anywhere.
Gotcha.
But they're widely used other places, and they have turned out to be far superior to DMPS, which was the best drug until now.
Okay.
And just similar to how we understand the growth hormone, you know, that growth hormone used to be injected, then it used to be delivered transdermally.
Right.
Then it was clear that growth hormone is nothing else but an array of different peptides linked together.
Okay.
Different amino acids linked together to make this peptide.
Okay.
And then Buttar found that he could just take these amino acids and put them together in a transdermal form, and if they're given at the same time, the amino acids then recombine once they're in the blood to growth hormone.
Gotcha.
And so what we will probably see with the transdermal deliveries of detox agents, why not use the branched chain amino acids and methionine and N-acetylcysteine, take all the very potent amino acids that are used for detox and put them on the skin.
Right.
That hasn't been done. Yeah, so
well, give us a week.
Yeah, well, so the good news is sort of that right now TDD-MPS is a prescription item, and I can promise you within a few years it will be replaced by non-prescription items that are at least just as powerful or even more powerful. Yeah, so it's just to get over that issue. It's just a matter of time until it's going to be very, very low dose amino acids of various sorts that are combined.
So now, having talked about the diagnostics that you just don't feel are really necessary with DMPS, let's talk about some diagnostics that these people, these parents, have at home. My three favorite are pee, poop, and pH. Because I feel like you've trained me well enough to believe that the world is your oyster from just observing those three things. Can you just...
And so let's talk about the pH.
Okay.
So everything I learned about the pH, I learned pretty much from Tim Ray, the guy who created NDF.
Okay.
And there's some early literature in Europe. And first of all, I don't want to go too much on what the pH is and all the chemistry. The ideal pH for the saliva is 6.7, and the ideal pH of the urine is 6.2, period. It should undulate over a 24-hour period in a 2.2 range above and below. So the ideal saliva range throughout the day is between 6.5 and 6.9. Yeah, it
Okay.
should undulate
Up
in
and
this,
down. Okay.
in this range, with 6.7 being in the middle.
Okay.
And the ideal range of the urine is from 6 to 6.4. It should
Okay.
undulate depending on when in the day you measure it.
Okay.
And the other thing that you have to know is that the urine eliminates toxins in the form of acids. We
Okay.
mentioned that before. And when the kidney starts failing, when the detox mechanisms that the body is using are not effective, the kidney is not eliminating acids. What then happens is that then acids build up in the system, and it makes the saliva more acidic. And what you get then is a shift in pH, where the saliva, or let's do it this way, where the saliva is more acidic than the urine. And
Okay.
that is a tragic point when we reach that, and we see that in all of our autistic kids. You know, the saliva being more acidic than the urine. That means these kidneys are not eliminating the toxins in form of acids.
Okay.
And that is again another indicator of the biological molecular pumps not working properly. You know?
So a parent shouldn't necessarily be shocked when it's
No,
reversed.
this is something you should expect,
Okay.
but know that this is something you absolutely have to address. And now, on the detox program that we've outlined here,
Well, we'll
at
do
the-
it better. On
Yeah,
paper.
looking at the electromagnetic stress, the exposures, reducing the environmental exposure, throwing the carpets out of the house, using a TDD-MPS, using the Vinitsky protocol, using the subdermal injections, you will see that when you hit the right intervention, that the saliva pH becomes more alkaline again, and the urine pH becomes more acidic. And you can monitor any of your interventions should have the goal to do this. And the test costs $6
Just pH
for the
paper.
pH paper. And with one roll of pH paper, you can do at least 3 to 6 months worth of continuous monitoring. And if you understand just that bit, you can guide your own treatment. If the pH isn't budging, the saliva stays more acidic than the urine, you know you're not getting it.
So you
And
keep
in that
switching it
situa-
up.
And in that situation, you'll never continue the DMPS. Because
Right.
what you're doing, you're adding to the toxic buildup.
Right.
Yeah.
You're mobilizing but not getting
Yeah.
out.
So you try the DMPS, and if it does this, you know it's working. If it doesn't, if this is stuck, or the saliva pH gets more acidic, you know you're endangering the child. You have to first resolve another glitch. Then you try the NDF. Yeah?
Okay.
Then you try the other interventions. Then you try to balance the vitamins, minerals, supplements. You try to remove allergenic foods, yeah, until this budges. And then you can go back to the original program.
And there's no specific time of the day other than they don't want to just be testing the residue of food in the mouth. They
Yeah.
It's a fairly clean mouth.
The only advice I give is whenever you measure the urine, at the same time you should measure the pH.
Or the mouth.
Within a few
Okay.
minutes, not that you get like 3-4 measurements during the day of the saliva and 3-4 of the
Okay.
urine
Same time.
at the same time. You want to see what is that relationship.
And it's basically just paper that as soon as the liquid contacts it, it changes color that you compare to a little set of colors.
Yeah.
It's very simple.
Yeah. So the only time you can't do it really is right after a meal. You know, when you
Okay.
have the food residues in your mouth.
Okay, so that covers a little bit of urine. What's that other trick in the morning with urine?
The other thing that we look in the urine is the ability of the kidneys to concentrate urine. It's called specific gravity. Now there's a dipstick you can buy at any pharmacy over the counter. You stick in there and it gives you a measurement of how much the urine concentrates, how much the kidneys concentrate the urine, the specific gravity. And the simple test is to simply, when the child is in a position where you can actually monitor the color of the pee of the child, when you're actually helping the child to pee,
Right.
if the urine in the morning looks like water, you know the kidneys are not doing their job. There's a biorhythm. In the morning, usually the biorhythm says this: in order for us to sleep, the kidneys have to stop producing urine at night. Because if they are, we have to get up all night long and pee.
Okay.
Yeah? So the kidneys at night stop producing urine, and then when you wake up, there's a massive buildup of toxins in the blood. And the kidneys very rapidly process a lot of toxins and create a lot of urine between waking up and within 10, 15, 20 minutes, you produce a full bladder.
Okay.
Yeah? So the kidneys kick in like this and produce urine. And now that urine should be concentrated, should be yellow and slightly stinky.
Okay.
And if it is clear and not stinky, you know the kidneys are not able to concentrate the urine. That is an indicator of heavy metal damage to the kidneys,
Okay.
and in itself an indication for DMPS.
But if you were doing DMPS and ran into that, you would back off.
If it occurs while you're treating on DMPS, we're feeling you've overwhelmed the kidneys and you
Okay.
have to back off, and it's good to get a homeopathic kidney drainage remedy on board.
Well, that's one thing just for parents who don't necessarily have access to a homeopath is the kids that seem to be doing the best on the DMPS are the ones who are on homeopathic drainage remedies, one of which is for the kidneys.
But the best drainage remedy, we've done a lot of looking into this, is it's called electrolyte matrix formula.
Okay.
It's a bottle with a salty tasting electrolyte solution, and every drink that the kid has should have some of that in it.
Oh, it has like homeopathics in it as well.
It has a homeopathic signature in it for kidney drainage, and it's
Good to know.
fantastic for getting the kidneys going while you're
Okay.
doing detox. And it's available from BioPure. You know, it's one of the major
BioPure,
products.
you like that company.
Well, it's a company that has structured all its products around what we're doing in detox. So they have nothing else. They only have these products. And
Right. Okay, now the last one. Poop.
so
What can we learn from their
Yeah.
poop?
so one of the major issues, of course, in autism is the digestion.
Right.
Leaky gut. We know that the kids get infected through the measles vaccine with the attenuated measles virus, which then becomes active in the gut and sets up housekeeping in the gut. That's research by Wakefield and other researchers that after he was fired from his hospital, his colleagues took over his research and confirmed his earlier data. And it's not just the measles virus, just one of the viruses. Once you have the measles set up the housekeeping here, there's chronic inflammation. With chronic inflammation, the pores in the gut become bigger, and now molecules that usually wouldn't fit through, and so food substances enter the bloodstream that wouldn't normally enter the bloodstream.
Just on that
Yeah.
note, really quickly, a mom was listening to the Autism One radio archive things, and people think that it's just the macro molecules of the gliadin and the one from milk and the one from wheat. But when they actually studied these kids, they found 29 undefinable macro protein molecules in these kids. So the idea that gluten and casein are the only producers of these
Yeah.
protein peptides that are potentially neurotoxic
Yeah.
is really not.
Yeah, and so the whole idea, with the muscle testing, we're always very careful in testing every single food the patient eats to see if the child has developed an allergy to it or an incompatibility with it. But the important thing is, in these kids, the gut gets damaged,
Right.
and a damaged gut doesn't function as a functioning barrier anymore, and things enter the bloodstream that shouldn't enter. And so that is toxicity on its own. There's acute toxicity after each meal,
Right.
from that. And so in order to repair the gut, it's a very, very important process in autism. In all other illnesses as well, but in autism more so than any other illness. And for the gut repair, we have a multitude of mechanisms, fortunately, through the naturopathic influence. We have, on one end, we have the colonics. On the other end, we have the different dietary things. That's why I think a high fiber, raw vegetable diet is very often fantastic for these kids. If you make it taste nice with a grated apple in it, and the kind of things that make it,
Xylitol.
or xylitol or FOS,